$500,000 sounds like a fortune until you realize it gives you less than $2,000 a month to live on. That's the uncomfortable math nobody wants to talk about. But what if I told you that number is both completely accurate and potentially meaningless depending on choices most people never think about? Let's get one thing straight right away. If you've managed to save $500,000 for retirement, you're already doing better than the majority of Americans. The median retirement savings for people aged 65 to 74 sits at around $200,000. So if you're sitting on $500,000, you've outperformed most of your peers. Yeah, that should feel good. But the real question isn't whether you've saved more than average. It's whether what you've saved can actually fund the retirement you're imagining. Here's where things get interesting. Take that $500,000 and apply the famous 4% withdrawal rule. In year one, you pull out 4%, which gives you $20,000. Then each year after that, you increase your withdrawal slightly to keep up with inflation. This approach was designed by financial planner William Bengen back in 1994, and it's based on historical market data showing that this method could sustain a portfolio for at least 30 years. It's not a guarantee, but it's held up through some brutal economic periods, including the Great Depression and the 2008 crash. So $20,000 per year breaks down to about $1,667 per month. Now, before you panic, remember that's just from your savings. Most people also have Social Security coming in, and that's where things start to shift dramatically. But we'll get to that in a moment because there's something else you need to understand first. That $1,667 monthly withdrawal isn't a fixed number that works for everyone. It's a starting point that gets completely reshaped by 5 critical factors. And I mean completely. The same $500,000 could fund a stress-free retirement in one scenario and have you counting pennies in another. These aren't minor adjustments. We're talking about the difference between living comfortably and struggling to cover basic expenses. The first factor is Social Security, and this is massive. Your benefit amount isn't some universal number everyone gets. It's calculated based on your 35 highest earning years, and the range is enormous. Someone who worked lower wage jobs their entire career might collect $1,400 per month at age 67. Add that to the portfolio withdrawal, and you're at $3,067 monthly. Not terrible, but not exactly luxurious either. Now compare that to someone who had a solid middle-class career, consistently earning around $60,000 per year. Their Social Security benefit comes in closer to $1,976 monthly. Combined with the portfolio withdrawal, that's $3,574 per month, or about $43,000 annually. That's an extra $6,000 per year compared to the lower earner, which over a 30-year retirement adds up to $180,000 in additional income. But it gets even more dramatic at the higher end. Someone who maxed out their Social Security taxes throughout their career, earning well into 6 figures, could be looking at $3,200 per month in benefits. Add the portfolio withdrawal, and they're pulling in $4,867 monthly, nearly $59,000 per year. Same $500,000 in savings, wildly different retirement lifestyles based purely on career earnings history. And here's what most people don't realize. You can check your exact projected benefit right now. The Social Security Administration has an online portal where you create an account and see precisely what you'll get at 62, at full retirement age, and at 70. It takes 5 minutes and eliminates all the guessing. This one number changes your entire retirement calculation, yet so many people just assume they'll get some average amount without ever actually checking. The second factor is location, and this one might be the biggest game changer of all. A retirement budget that works perfectly in Knoxville, Tennessee will absolutely destroy you in Manhattan. We're not talking about slight differences in cost of living. We're talking about scenarios where the same monthly income creates 2 completely different realities. Imagine someone trying to retire in New York City on that $3,574 monthly income we calculated earlier. A modest one-bedroom apartment in Queens runs about $2,400 per month. That's before utilities, groceries, transportation, healthcare, or literally anything else. They're left with about $1,200 to cover everything else in one of the most expensive cities in America. One unexpected expense, a dental emergency, an AC unit dying in July, and they're dipping into principal. That's not a sustainable retirement. That's financial stress with slightly more free time. Now take that exact same income to a place like Knoxville. A nice two-bedroom apartment costs around $1,100 monthly. Utilities run about $120. Groceries are roughly $350. Add in car expenses, insurance, and healthcare supplements, and total monthly costs come to around $2,270. That leaves over $1,300 of breathing room every month. That's travel money. That's dining out without guilt. That's building an actual emergency fund instead of hoping nothing goes wrong. The math here is brutal. Living in a high-cost area versus a moderate-cost area creates a difference of over $13,000 annually in discretionary income. Multiply that by 30 years, and you're looking at nearly $400,000. That's almost as much as the entire nest egg we started with. Location isn't just important. For many people, it's the single decision that determines whether retirement feels comfortable or constantly stressful. But before you start researching moving trucks and apartment listings, there's a third factor that catches almost everyone off guard: healthcare costs. This is where most retirement plans don't just stumble, they completely collapse. Not because people ignore healthcare, but because they massively underestimate what it actually takes to stay healthy after leaving employer coverage behind. If you retire at 60, you're buying private insurance for 5 full years before Medicare arrives. The average premium for a 60-year-old in 2025 sits around $950 monthly. Then there's your deductible, typically $7,000 annually. First year alone, you're spending over $18,000 just on healthcare. That's almost your entire $20,000 portfolio withdrawal consumed by medical costs. For 5 consecutive years, you're burning through roughly $90,000 minimum, assuming nothing major goes wrong. No surgeries, no chronic conditions developing, no emergency room visits. Then Medicare kicks in at 65 and everyone assumes the bleeding stops. Not quite. Part B premiums cost $185 monthly. Part D prescription coverage averages $50 per month. You'll want either a Medigap supplement or Medicare Advantage plan, adding another $200 monthly. Dental and vision aren't covered, so budget another $100. Total monthly healthcare cost, even with Medicare, is around $535 or $6,400 annually. Better than $18,000, absolutely, but still a substantial ongoing expense that never disappears. Fidelity estimates the average couple retiring at 65 needs $315,000 just for health care throughout retirement. Think about that number. If you've got $500,000 saved and need to mentally allocate $315,000 for medical costs, you're really working with $185,000 for everything else over 3 decades. This is precisely why retiring at 65 instead of 60 matters so much. Those 5 years save over $90,000 in insurance premiums. Let your portfolio compound longer, increase Social Security benefits through delayed claiming, and reduce the total years your money needs to stretch. The fourth factor is inflation and how your money is actually invested. Your expenses climb every year, but your savings don't automatically follow unless you're strategic about growth. Take that $35.74 monthly budget we've been using. With 3% average inflation, in 10 years, you'll need $4,800 to buy identical goods. 20 years out, that number becomes $64.54. By year 30, you're needing $86.77 monthly just to maintain the same lifestyle. Your $400 grocery bill becomes $722 in 2 decades. That $1,100 rent jumps to $1,988. This is why parking everything in a savings account earning 1% is financial self-sabotage. You need actual growth, or you're slowly going broke while thinking safety is the priority. Most advisors recommend a 60% stock, 35% bond, 5% cash split when first retiring. As you age, gradually shift more toward bonds for stability. The reasoning is straightforward. Stocks historically returned 10% annually since 1926. Bonds averaged 5, inflation ran 3. Sitting in all bonds, earning 5 with 3% inflation only gains you 2% in real purchasing power. A balanced portfolio getting 7% with 3% inflation gives 4% real growth. Over 30 years, that difference is staggering. 2% real return grows 500,000 to roughly 900,000. 4% real return turns it into 1.6 million. That's the difference between scraping by and living comfortably. But there's danger here called sequence of returns risk. If you retire right before a market crash and start withdrawals while stocks are down, you can permanently cripple your portfolio's recovery ability. The solution is a bucket strategy. Keep 2 to 3 years of expenses in cash or safe bonds, about $85,000 if you're spending $43,000 yearly. When markets crash, you're not forced to sell stocks at losses. You spend from cash while waiting for recovery. That remaining $415 stays invested for growth during good years. Refill your cash bucket. Not exciting, but effective. The fifth factor is debt, and this one can override everything else we've discussed. Two people with identical $500,000 savings can have completely opposite retirement experiences based purely on debt load. Debt-free, Diana owns her home outright. No car payment, no credit cards. Monthly expenses total $2,800. Monthly income is $3,574. She's got $774 left over, about $9,300 annually. Diana's comfortable, building emergency funds, taking annual vacations, sleeping soundly. Debt burden. Dan still owes $180 on his mortgage at $1,400 monthly. Car payment is $350. Credit card minimums are $200 plus those same $2,800 in other expenses. Total monthly costs are $4,750. His income remains $3,574. Dan runs a deficit of $1,176 every month. That's $14,000 annually pulled from principal. At this rate, Dan's $500,000 evaporates in 17 years. He'll be 82 with nothing but Social Security. Diana, meanwhile, is actually building wealth during retirement. The mortgage debate is real. If your rate is under 4%, mathematically, you could earn more by investing instead of paying it off. But the peace of mind from eliminating that payment has value beyond spreadsheets. No mortgage means less required income, smaller portfolio withdrawals, money lasting longer. If something goes sideways, health emergency, or market crash, you're not worried about losing your home. So can you retire on $500,000? If you're debt-free, strategic about location, managing healthcare smartly, and have decent Social Security? Absolutely. Carrying debt, locked into expensive areas, retiring before 65 with low benefits. Probably not without major adjustments. Most people aren't failing retirement because they didn't save enough. They're failing because they didn't plan specifically enough. The median retirement savings for Americans 65 to 74 is $200,000. If you've got $500, you're ahead of 60% of retirees. The question isn't whether it's enough in some abstract sense. It's whether it's enough for the specific life you want to live. Your retirement isn't determined by one account balance. It's determined by the decisions you make about these 5 factors. Someone out there is living their dream retirement on $500,000, while someone else with $2 million is stressed and miserable because they ignored these factors. The money is just the tool. Your plan is what actually matters. Look at your Social Security statement today. Run the numbers on 3 different locations you'd actually consider living. Price out healthcare coverage for your specific age and situation. Check what you're really paying in debt service every month. Calculate what your investments are actually earning after inflation. Do that and you'll know exactly whether $500,000 works for you, not for some theoretical average person who doesn't exist. Most retirement advice treats everyone like they're the same person living the same life, in the same place with the same expenses. That's useless. Your number is your number based on your choices. 500,000 could be more than enough or nowhere close. The only way to know is to stop guessing and start calculating with your actual situation. Because retiring successfully isn't about hitting some magic account balance. It's about understanding exactly what that balance can and cannot do given the life you're planning to live.